What is going on, gangers? Brother Nandi back at your service, and I'm here to dive into a continuing series where we look at fictional characters and what health conditions they may have. If you'd like to stay caught up with this series, please make sure you subscribe to my channel. For part 9 of this series, we are going to dive into a fictional character that people may or may not know, and her name is Nami from One Piece. I decided to use Lyme disease to describe Nami's illness. Let's first dive into what Lyme disease actually is. Lyme disease is an infectious bacterial disease that is usually transmitted by ticks. And these are usually prevalent in the North American region where it's a lot of wood areas. Humans usually get this by going camping, going into the woods, or simply if they have a pet, the ticks are just hanging into their fur. Deers are usually good hosts for ticks. Humans will get this infection by the tick biting them. Ticks transmit the bacteria through their saliva. Let's talk about signs and symptoms of Lyme disease. A common one would be what we call bull's eye rash. One would also develop flu-like symptoms, fatigue, and a headache. Also, complications could result in joint pain, heart problems, or neurological issues. Now let's think about Nami for a second. She got bit by a tick, and it was clear and noticeable on her abdomen. This occurred in Little Garden, I believe. It almost resembles a bullseye rash. She also had a very high fever. It was so high that she collapsed. She had a big headache, as she told Zoro, and she was very fatigued. Now, how does one treat Lyme disease? For the most part, this would be up to a clinical provider to diagnose. They would rule out other diagnoses, and they would review the case based on the signs and symptoms and the history of exposure in the specific areas. Well, you could do a blood test like a CBC, I guess. Now let's talk about how we would treat Lyme disease. The pure and obvious case would be antibiotics. Depending on the progression of the Lyme disease, will determine what treatment to give. But for the most part, we are going to give antibiotics. For example, amoxicillin, doxycycline, or ceftriaxone. In Nami's case, this is exactly what she needed as well, and she was given this by Chopper. Now for the future, let's try to avoid ticks. Repellent spray is key, guys. And always check for ticks when you go into woody areas, or even long sleeves when you go into the woods. As I always say, if you have any of these health conditions or illnesses, please seek help immediately, because we want you to get the help that you deserve. Fictional characters were used to put a different perspective into these situations. If you appreciate this video, please like, comment, and subscribe. If you have a suggestion for next part in this series, please comment down below. And guys, I just have to say this. I am not a doctor. I'm only giving information for awareness. But take this information with your own discretion. But if nothing else, y'all take it easy.